Hello, everyone. Thank you for joining us today. My name is Victoria Duckworth. I am the product manager for Opal reagents here at Akoya Biosciences. And today I'm very excited to be introducing to everyone our new fully optimized MOTiF PD-1, PD-L1 panel kits, which have been optimized for lung cancer and melanoma samples. As we go through today, we're going to cover three main agenda topics. So first, we're going to talk about Opal and MOTiF and the Fluorescent Multiplex IHC assays. Then we're going to get right into the new PD-1, PD-L1 panels. And lastly, we're going to talk about some of the things that you can implement in your laboratory to ensure that every assay is a success, from pre-analytics, automation platforms, as well as tips and tricks for customization for these new panels. So Phenoptics as a whole, as a part of Akoya Biosciences, has largely focused on immuno-oncology, as cancer immunotherapies have driven a huge paradigm shift in the treatment of cancer patients worldwide. So by focusing therapy on the interaction between the tumor and the immune system, responsive patients have been found to have a much more durable response than therapies that simply target tumorigenesis. But unfortunately, despite the incredible benefit of longer response times, the biggest challenge with these cancer immunotherapies has been actively identifying which patients will respond to these treatments. So from these two examples, traditionally targeted therapies like EGFR based on a much simpler principle than immunotherapies like PD-1, PD-L1 checkpoints, which are dependent not only on things like the tumor mutation burden, but also how the host immune system is responding to that tumor. Because of this complexity, traditional biomarker testing has not been adequate in predicting which patients will respond to treatment. So essentially, new challenges are extending into the translational research space because of the complexity of the host immune system. So we see trends emerging in biomarker research like new checkpoint inhibitors that go beyond the traditional PD-1, PD-L1. Things like immunoprofiling patients based on that tumor microenvironment. We see things like immune exclusion or desertion, infiltration, and understanding where immune cells are in spatial relation to the tumor itself. And of course, emerging is combination therapies and trials and understanding stratification based on how a patient is more likely to respond to a therapy or not. So some of the things that become critical attributes for research to address these new trends, things like having tissue for spatial context. So no more sort of bind and grind to understand phenotypic heterogeneity, where we understand that the spatial context of where cells are is just as important as how many cells there are, which runs into multiplexing and being able to reliably detect phenotypes and their functional states, as well as, of course, implementing a robust and efficient workflow, as we understand that time becomes of the essence as well as throughput when running a study. So this is where Opal comes in. So with the power of Opal Fluorophores for multiplexing, you're able to do things such as retain spatial context so that you really can interrogate the tumor microenvironment in an interactive situation. You also can multiplex with ease. Essentially, and I'll show you in the next slide, Opal is simply an iterative IHC assay. So if in your lab you're able to implement single stain DAB, you can just as easily implement Opal IHC because it's, the same workflow. As well as now unlock greater multiplexing. So with the Opal solution, you can capture up to 8 markers or 9 colors of interest, that 9th color being DAPI, or a nuclear marker of your choice, on a single tissue section. So you can support biomarker discovery in ways that you've never been able to do before, retaining blocks, have high throughput, high complexity without any sort of tissue ablation or grind and bind methods. So this is how Opal works. In this particular example, we're showing a slide on the BondRx from Leica Biosystems. However, the Opal assay regimen can be done on multiple other kinds of auto stainers as well as manually. We just use a microwave. But essentially, it's this. So in this example, we have 4 antigens that we're interested in targeting, all of them with a same species rabbit primary antibody. So after you do your normal preparative steps for IHC, such as DWAX and antigen retrieval, you come in with your primary antibody. You come in with your secondary antibody that's species specific, labeled with a HRP, same as you would with DAB. And then you add the Opal Fluorophore, which interacts with the HRP, is turned over by that enzyme, creates a free radical that covalently binds to any tyramide residue within 10 nanometers of the target on the tissue. So now what you're able to do, that you have this signal that's covalently bound to your antigen, is come in with a heat stripping step, same as antigen retrieval, and remove the previously bound primary and secondary antibody. This means that you can then come in with a new primary antibody of the same species without worrying about any sort of species-species crosstalk. And again, in this example, it's just a 4-plex, but we can do up to 8-plex on a single slide. So how can we do that? What is the capability to put 8 distinct fluorophores on one slide? Well, this is the power of the vector Polaris and part of the MOTiF workflow. So with traditional narrowband fluorescent scanners, you have certain filters that are set up to visualize each individual marker. So for here, we would have DAPI, we would have CD8, which would be in the 480 channel, PDL1 in 520, and so on and so forth. And you can see that some of these fluorophores emit and excite in multi-band channels, not just in their one single channel. So what the Polaris is able to do is come through and isolate each and every signal that is appropriate for the marker of interest, and once isolated, allows you to ensure that you are only receiving the signal intensity from the marker of interest in the channel in which you are attempting to interrogate it, so you can phenotype more appropriately and more quantitatively. And that's the essential premise of unmixing. But the other benefit is that not only is your tissue emitting the signals from each of the markers that you've laid down, it's also emitting its own autofluorescent spectra. So the vector Polaris can also isolate the autofluorescent spectra and remove it from your sample. So the MOTiF workflow is pretty simple. It's essentially a combination of all pieces of the Phenoptics solution, and it looks something like this if implemented in your laboratory. Your oncologists or pathologists have sections of interest that they're interested in, unstained, prepped slides. They're stained with Opal reagents on the BondRx or manually. Once stained, you have your beautiful 6-plex slides, which you can then visualize on the vector Polaris. The vector Polaris scans, and you move your scans into the viewer PhenoChart, and within PhenoChart, you're able to apply the unmixing algorithms from the Polaris and fully unmix your samples so that you can discreetly turn on and off channels, visualize your expression patterns, and also phenotype accurately, which is when we move into the machine learning software Inform, which allows you to do things like tissue segmentation, cell segmentation, phenotyping. And once you have your data outputs from Inform, you can move it into your favorite large-scale analytical software. For example, here we have R, where we have pre-programmed algorithms or plugins into R called Phenopter and Phenopter reports to help consolidate your data and digest it in a much easier way. So now that we know what Opal is and what the MOTiF workflow is, I'm excited to introduce our new fully optimized PD-1, PD-L1 panel kits for the BondRx on melanoma samples and lung carcinoma. So as we develop new panel kits for our users, there are several questions that we want to ensure that we're asking ourselves. So are we providing something that for the researchers in the immuno-oncology field is the right tool for the job? So there's several things that we go through when we're attempting to decide something like this. Number one, I think it's pretty clear. The kit needs to work, right? So what does that mean? It obviously has to be robust, reproducible, predictable, as well as reliable. It needs to be easy. So the antibody order and detection pairings for your Opal assay need to be defined. That decision needs to be made. And you need full protocols available at the click of a link across the workflow, again, to reduce the complexity and the probability of error. It needs to be fast. It needs to be fully automated. We need ready-to-use primary and secondary antibodies. Again, take away ambiguity. And we need same-day imaging and analysis and tools that are going to help us get there. Lastly, it needs to be relevant. In this case, it's 6-plex, 7-color, the most information that you can get in the MOTiF workflow, same-day image analysis, and it needs to have PD1 and PD-L1 on the same sample. Obviously, those two interactions are amongst the most important in the field, and having an assay that doesn't include those two antibodies in one panel makes it much more challenging to do the level of research that we need to do. So these are the new PD1, PD-L1 panel kits. You can see here that they come with ready-to-use primary antibodies and all of the MOTiF opals that you've become accustomed to throughout the years. It comes in that both melanoma flavor and the lung cancer flavor. We validated on both of these tissues. So on the melanoma kit, the tumor marker is a cocktail of SOX10 and S100. However, it's up to you as the user if you choose to use that cocktail or not. You could use one or the other. And then on the lung cancer kit, we have pancytokeratin as the tumor marker. Now, we've only validated the lung cancer kit on lung cancer, obviously. However, it is a pancytokeratin marker, so with just a little tweaking, it could work on a wide variety of tissues. So across the entire Phenoptics workflow, we're making available these ready-to-use automated panel kits. But not only that, as we've included the entire MOTiF solution, we have pre-optimized and downloadable vector Polaris acquisition protocols available as well. These are a great starting point so that you don't have to worry too much about things like exposure times, because we've already adjusted for the expected level of intensity from each of those markers and the panels. And lastly, we're introducing something that's brand new for us, which is a rules-based informed phenotyper. These are pre-configured directly for these two panels. They include things like the Opal and antibody pairing, the order in which they're applied. They also have incorporated into them things like copositivity and exclusivity rules so that you can know with confidence, even if you're looking at something like CD8 positive T cell fully infiltrated into an area of tumor, that the exclusivity rules give priority to that CD8 to call it so that you're not missing a single solitary TIL. So with these new kits, you now have the ability to interrogate the biology of the samples that you're looking at all scales. So in this particular example, we're utilizing one of the outputs from Phenopta reports that allows you to look at cell density maps. So you can see across the top row, we have positivity heat maps for single positive cells. But on the bottom row, we can also do things like interrogate double positivity or even the spatial relationships between where those phenotypes are in relation to each other within the hotspots of your sample. You can also utilize these kits to interrogate features like cell density in bands from the tumor margin radially out to see if perhaps the tumor that you're interrogating has some sort of immune exclusion. Or you can look along the margin and understand infiltration to see if perhaps there's a higher density of TILs inside or outside the tumor stroma margin. So in action, this is what the kits look like. So this particular example is a lung cancer. So first we start off with DAPI. So we get the morphology. It's a nuclear stain. Then we add in our pancytokeratin, our tumor marker, which gives us the lay of the land, so we understand what's stroma and what's not. Then we can add in CD8, see if we have any infiltrating T cells, see the density of T cells within the stroma. And then we add in PD1, and we can understand the level of exhaustion that's occurring around the tumor. Next, we have FOXP3, so we can understand where our Tregs are in relation to our cytotoxic T cells. We have CD68, our macrophage marker, to get a better feel for where PD-L1 is being expressed. And lastly, PD-L1. These kits have been fully optimized for automation on the BondRx from Leica Biosystems. For these kits, on their product pages, we have full protocols ready and available for you to use. It has all of the instructions for use on the BondRx, as well as the order of application and any additional required materials or considerations for the reagents. On the BondRx, we found that we have extremely low staining variability between slides. This particular example, this is a Monoplex with CD20 on tonsil with Opal 520, and running 30 slides at a time, we get CVs of below 5%. This holds true even when you begin increasing your plexing capability. So here, looking at the mean counts of the top 20 cells per slide, our CVs are still below 15% for every individual marker in this particular example on the BondRx. So this is the same level of consistency for automation that you can expect when you are running these new multiplex kits. Next, I'd like to talk about some of the pre-analytical considerations for success that might be worth implementing in your own laboratory. So a lot of the things that I'm going to talk about really from here on out apply pretty globally across Opal multiplexing, but also IHC in general, because it's important to remember that if an antibody works, DAB, IHC singleplex, it's likely going to work for Opal as well. And the things that are going to bring you success on an Opal multiplex are the same things that you've already implemented to bring you success in your single stains. So there's a lot of important considerations, particularly around your pre-analytical side, what's happening right in your own histo lab. So I'm going to talk through a few of the items in this paper throughout the rest of the webinar. It's one of my absolute favorites. It is called Garbage In, Garbage Out, and it has a lot of great gems in it. So I do highly recommend that you give it a read after the webinar is concluded. So the first piece that I'd like to talk about is tissue handling and how important it is to ensure that the tissue that you're using for your IHC has been appropriately handled. If we think about resection times and ischemic time particularly, there are certain antigens that are much more sensitive to ischemic time than others. And this becomes important, particularly in the context of a multiplex, because perhaps one of your targets that you're interrogating really holds up well, it doesn't oxidize very quickly, but another might. So ensuring that your tissue has been handled appropriately post-resection is very important to ensure that you're not getting false negatives when you are running your multiplex. The same basic principle counts for tissue fixation as well. In the world of IHC, we do generally suggest that you use a 10% NBF for your fixative, keeping in mind that formalin does penetrate tissue sections at a rate of about 1 millimeter per hour. So larger sections could stand to be fixed for a longer amount of time, and smaller ones, something like a punch, for a very short period of time. But the rule of thumb is, in general, about 24 hours of fixation time. But what does it look like if we underfix? So here's just two examples that I pulled from one of Leica's many great resources for pre-analytics. We can see here in figure A on the left, estrogen receptor on breast carcinoma. So we see a tissue block that's fixed for 3 hours, showing really weak staining, and you can even see that the hematoxylin counter stain is also kind of weak and honestly sad, versus a tissue block that was fixed for 8 hours, where we see much more robust staining. And the CD45 staining on the right is even more indicative of what underfixation can do. Simply, you're losing anagenicity, and as oxidation comes through, you're trying to stop the rot, and if you don't fix properly, you don't. The next factor that I would like to talk about is section storage. So this is one that we get asked pretty frequently about, how long can we have cut slides for, or what is cut slide stability? And again, this is very variable depending on your particular antigen. The key for section storage really is that you need to keep them dry, because any water is going to come in and it's going to oxidize and destroy anagenicity. Now, there are things that are much more sensitive to that sort of damage, like RNA, if you happen to be doing any ISH work. But there are also IHC antigens that are extremely variable in terms of how well they hold up in cut slide stability. Another important piece is also just the glass chemistry itself of your slides. Your glass slides will lose their plus charge over time, meaning that your staining could become variable or your tissue could fall off during processing. So we like to say that no more than 2 months old per cut slide. Or if you're going to store them long term, what we tend to do is store them vacuum sealed with a desiccant in the -80 to ensure that you keep out as much moisture as possible. Because again, these are all factors that will impact the success of your staining with these new MOTiF kits, or really just in general. It's just good tissue hygiene is a really important part of having successful high throughput studies. Okay, on to the really fun part. So customization and optimization. So one of the things that's really important about Opal in general is the flexibility that the detection system imparts. So open detection, you're able to use any primary antibody. And in this case, we've chosen the 6 most clinically relevant primary antibodies for you. But say you want one of your own over one of these, that's something that we can work with as well. So in general, the multiplex development procedure or process looks something like this. So for these kits, of course, we've taken out all of the decision making and we've sort of done all of the hard work and validation in our R&D department for you. However, if you are going to choose to customize these assays, there is still a little bit of work you have to do, but more towards the back end. So obviously, you don't have to do step 1, but step 5 is probably a good idea. So let's talk about what that looks like. Back to garbage in, garbage out. So your choice of antibody when you are going to either use the open Opal detection systems for flexibility or customize one of these new kits is extremely important, because certainly not all antibodies or clones are created equal. So here's an example of 2 CD8 clones run on the same tissue, serial sections. Their concentrations were approximately equal, so these dilution factors aren't reflective of concentration being wildly out of whack. But we can see that clone A has much more robust staining than clone B. These are 2 of the more popular CD8 clones on the market. I'm sure you can guess what they are. But you can see that there's, even in these, relatively high regarded clones, a significant difference in staining intensity and signal intensity. Another piece that's important to ensure that you work out as you are developing a new antibody for a multiplex is exactly which titration you're going to use. So here we have an example with pancytokeratin, and this guy is, of course, a pretty strong expressor. So there's a couple of things that you're balancing when you're trying to decide which titration of antibody is appropriate for you. Number one being, when do we reach epitope saturation? There's no need to go higher in concentration once you've reached saturation of your epitopes. And in fact, we would advise against that because we've seen sometimes you can run into stripping problems in an iterative assay if your antibody concentration is too high. But on the reverse, you don't want to go too low, as we see in this example in the 1 to 400, where we begin to really obviously lose full staining complexity. The pattern has changed dramatically. So here we would go with somewhere around the 1 to 200. Lastly, epitope retrieval is an extremely important factor in determining how you are best going to be able to visualize your target, obviously. So in this particular example, we have 2 Ki67 markers, or 1 Ki67 marker stained on serial sections. One is with the pH 6 citrate-based antigen buffer, and the other is with the pH 9 like EDTA based antigen retrieval buffer. And as you can see on the left, we have much less staining for our Ki67 in this germinal center on tonsil than we do on the right. But the interesting thing about this particular example is that the antigen retrieval conditions on the left were actually the vendor's recommended, and the right we found worked better. So it's always worth giving it a shot and seeing what antibody parameters are going to actually work best for the antibody that you choose to bring into your multiplex. And that looks something like this. So when you're choosing your parameters, knowing what we know now from the previous slides, you want to optimize the retrieval conditions for your antigen, and you want to assess staining for completeness, correctness, and dynamic range, while also not oversaturating. So the way that we start here is we, in just 6 slides, find the antibody parameters that are correct for us. And you can do this in DAB. The vendor's recommended dilution for the antibody, 2 times concentrated, or 2 times dilution and 4 times dilution. And just try it with both that pH 6 and pH 9 retrieval buffer. So within 6 slides, you can get an assessment of exactly what makes that particular antibody happy and build that into your multiplex. By building that into your multiplex, I mean choosing your substrate-antibody pairing and your staining order. So when you're choosing the order in which your iterative assay will be run, there's a couple of important factors to keep in mind. So things like the colocalization of markers. Say you wanted to replace the CD68 in the new kit with a CD3. Now we have 3 antibodies that could potentially be in one cell compartment on one particular cell. That would be CD8, PD1, and CD3. So you'd want to ensure that those weren't utilizing consecutive Opal dyes to ensure that the spectra does not crosstalk. You also want to interrogate things like expression patterns. So what's the dynamic range like for the particular marker you're interested in interrogating, as well as, I said before, those epitope retrieval conditions. So when you pull that all together, here's an example of both FOXP3 and a little later on PDL1 run in either the first position, the third position, or the 6th position. And remember, that means that it's been exposed to either 1 round of antigen retrieval, 2 rounds of antigen retrieval, or 5 rounds of antigen retrieval. And if we think of antigen retrieval as essentially the controlled destruction of tissue as we're breaking those formalin cross-link bridges, you have the ability to both open up new epitopes for your target of interest, but you also stand the risk of opening up less non-specific, just oily patches in the tissue that will bind with your antibodies and create background. So it is a balancing act. Here we can see, if we take away the DAPI, FOXP3 looks pretty happy in the first position in pH 9. pH 6, not so much. If we look at PD-L1 here, here's with the DAPI background, but if we take the DAPI away, it makes it a little easier to see. We can see that PD-L1 in pH 9, it appears as though it actually increases in intensity, and it does with pH 6 as well. So if we quantify these series of images and look at the top 3,000 pixels or signal intensity or expression of these markers, we can actually see that what we were looking at made a lot of sense. So FOXP3, definitely the happiest in the first position with AR9. And PD-L1 tends to just increase as you go through each and every iterative staining cycle. But remember what I said about background. So we see that we have very high Opal 520 counts when PD-L1 is in the 6th position. But if now we look at the bottom 10% pixels, which is essentially the background of the image, we can see that in the 6th position, PD-L1's background shoots up pretty high. So even though we're getting higher intensity counts, we're also effectively getting more background. So ensuring that we balance that signal to background noise as we determine our ordering and our epitope retrieval conditions is also of vital importance. One question that we do get is how should we order our opal dyes through the iterative staining and stripping process? So we've done several studies to show that the opal dyes are stable through ER repetition on the BondRx. So when you are defining your order for a custom assay, you can pay only attention to the needs of your particular antibody, with the exception of Opal Polaris 780, which must always go last because he is antibody mediated. And one last note about automation: if you are going to customize your assay, it's important to understand that a one-time run of dropout control slides is highly recommended to ensure that you're getting complete stripping throughout the staining procedure. As we developed this ready-to-use assay, this was a pretty stringent control that we went through to ensure that all previously bound primary and secondary antibodies were in fact removed from the tissue. So we implore you to do the same stripping efficiency test to ensure that you're not getting any crosstalk. And there you have it. So today we reviewed the Opal process, the MOTiF workflow, as well as our brand new 7-color PD-1, PD-L1 panel kits for lung cancer and melanoma. We also talked about some of the tips and tricks that you can implement for pre-analytical success, as well as customization and development of your very own Opal assays in your lab. If you have any questions about developing your own unique assays, please feel free to reach out to us. We love to help you succeed, as well as see a lot of beautiful images. And I think now we have time for questions. Thanks, guys.